Hello, I'm Deborah Kayli, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spill, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole-person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Today's guest is Kayli Anderson, a plant-based registered dietitian, a natural food chef, women's health maven, lifestyle medicine content expert, and entrepreneur. We are so excited to talk with her today. She also is a leader in the American College of Lifestyle Medicine, ACLM, having chaired the member interest group for dietitians and now co-chairing the interest group for women's health. She's created a unique niche for her business, marrying her passion for lifestyle medicine with women's health. And that is reflected in her life's work that includes many endeavors such as writing and speaking, educating, and working one-on-one with clients to help achieve deep, meaningful, and lasting health transformation. She's been featured in a number of magazines, including Forbes, Shape, St. Louis Magazine, and Feast. Kayli describes an epiphany she had a number of years ago in her practice that food is so much more than just physical health. It's deeply intertwined with your history, traumas, joys, relationships, culture, pleasure, and mental and emotional well-being. And that epiphany sparked her curiosity, and she embarked on a journey to learn even more through education in lifestyle medicine, intuitive eating, and exercise physiology. And we are so honored to have her here with us, as Deborah and I are two nurses passionate about the health of people and planet. So welcome, Kayli. Thank you for talking with us today.
Thank you. I'm happy to be here with both of you.
Before we recorded, we started talking a little bit about how we can synergize our work a little bit better, maybe between nurses and dietitians. Because you and Deborah have had a relationship and conversation before, I'm actually going to hand it over to you, Deborah, so we can hone in on the things that we really want Kayli to talk about today, if that's okay with you.
Thank you so much, Susie, and thank you, Kayli, for being here with us. I think I'd love to just open it up. We had a beautiful conversation right prior to this and just ask, given what we shared about, if we might ask you to just take it from there, your thoughts about the spaces that nurses and RDs are practicing in, how we can understand one another better, work together, learn from one another, and most importantly, how we can open this up for nurses where you see them practicing in this great need that's out there with the 4 million nurses and the nutrition education, and where those boundaries would possibly be.
Sure. Yeah. So I think you said something really wonderful, Deborah, when you drew the similarity between the nursing profession and the dietetics profession. And it being predominantly women and more of a helper profession. Not that physicians are not helpers, but it's just a kind of a different dynamic with the patient compared to what the dietitian has and what the nurse has in their relationship with the patient. And I think you're right that it is a similar relationship and often more of a supportive role. And that has caused lots of highs and lows and issues and things in our professions, I think, that are very similar. But I do think that both of our professions hold a lot of power in the relationship that we form with the patient and the ability to really take whatever that diagnosis is or whatever the treatment plan is and help actually implement it for the patient. And as far as the scope of practice line is what we're talking about between talking about nutrition from a dietetics perspective versus a nursing perspective. My opinion is that the more places that a patient is hearing that similar lifestyle medicine message, the better. So if they're hearing that from their doctor first, fantastic. And then if they're hearing that from a dietitian, and then they're also hearing that from a nurse, and then they're hearing it from their OT or PT and everybody on their care team, that's really the most powerful thing, right? Because we want them to hear that same message and get different ideas of how to implement that message. So when I think about scope of practice, certainly there's a lot that a dietitian can do as far as medical nutrition therapy that might be a little bit outside of what a nurse's education is as far as nutrition goes, and certain recommendations that can be made that are maybe a bit more granular. But when we're talking about those overarching principles of what we learn about in lifestyle medicine as far as nutrition goes, a nurse should definitely be communicating and educating on those topics. And a nurse probably has a lot more touch points with a patient than a dietitian might. And that might just be one exchange, 1 hour, if someone is diagnosed with diabetes, for example, for the first time. And then a nurse might see them every time they come for an appointment or whatever the setting is. And a nurse might have other ideas that the dietitian didn't have a chance to share about, okay, I know this about your life, or I know this about your family. How about you try this? What about this recipe? I really loved this, or things like that really help cement that information for the patient. So I don't know if that's what you were getting at, but that's my thoughts on our conversation prior to starting to record today.
Thank you so much. That's really beautiful. And it's emblematic of the approach that's been literally laid out by the founders of lifestyle medicine, is this team-based approach and touch point after touch point, reinforcing that and supporting that patient.
Mm-hmm.
Are there ways that you feel that as nurses and as dietitians that we can collaborate and synergize our energies more? Since you put it so beautifully, we're coming from this other space, this supporting role with our patients.
Yeah, and I think as I said, that's really where our power is. The doctor might not form that really close relationship with a patient that we might have in our professions. And so our expertise is really on what that patient needs or what's realistic, what tools do they need, and that sort of thing. So I see that as being a wonderful place to collaborate on really practical tools, things that people can implement in their lives that they might not be getting from their 15 minutes with their physician.
I guess even in terms of notes, knowing that the dietitian might be seeing the patient, if we put things in about dental issues and other kinds of physical barriers that may not be totally apparent, or food access, then that could be built into the dietitian's approach when they're meeting with that patient with a new onset diabetes, or they just had an MI or whatever.
Absolutely. Yeah.
We wanted to touch on any red flags or instances in which a nurse that's working with a patient should be referring to a dietitian immediately or promptly, and also any barriers that you could then share with us about access that you are seeing every day for patients that you'd love to be seeing and you can't. So the red flags for us to refer, and then also the barriers that tell us about what you're facing.
Sure. Yeah. And I think We have to put the backdrop of, and you alluded to this in our conversation before, that not all dietitians share the same nutrition philosophy, and same with nurses, same with physicians. Nutrition is one of those pillars of lifestyle medicine that is the Wild West. And even though we have all this wonderful foundational research that shows us what an optimal eating pattern is, we still see keto and paleo and all of these things come up, and dietitians and other healthcare providers are not immune to those sorts of trends, unfortunately. And so I think that's the caveat that a lot of people talk about. If they refer to a dietitian, they're not sure exactly what's going to come of that. And touched on that when you were talking about someone in your family having certain recommendations come up that were a little counter to what we would really want to see recommended for them. And so I think that is the caveat. And that's really what we're doing with ACLM, is trying to educate and have that shared knowledge of what the evidence shows. And so we're all speaking the same language when we're talking about nutrition recommendations. So with that said, if you are a nurse and you have access to a dietitian who you know has that education and you trust what they're going to be communicating to the patient, I would say, as far as red flags, anything that feels a little deeper than just that general education. So if they have another diagnosis, say they have diverticulitis or an eating disorder or something like that going on, that's probably a good place for a dietitian to step in and do a bit more of a granular assessment and recommendation for that person. And so I often think about that as like the nutrition therapy that the dietitian can do versus nutrition education, which a lot of healthcare providers are capable of providing that education. But when you get into that really specific, what nutrients are you deficient in, or certain health conditions that might have different interactions or whatever going on, then a dietitian, that would be a good time to step in. Unfortunately, there are a lot of barriers in dietetics with reimbursement limitations, and really just people's access to a dietitian is extremely limited. It's unfortunately very hard for people to get nutrition services covered. And so that is really why we shouldn't be putting up a bunch of blockers for other healthcare providers to be communicating basic nutrition education for people, because that person might otherwise not hear that information. They might not ever see a dietitian. And so if they're seeing a nurse who's able to give them a handout from ACLM and give them some basic education, that's way better than nothing.
Thank you. I have one quick follow-up to that. I want to turn it over to Susie in our remaining minutes here, is that if a nurse is out there and they are meeting an RD that hasn't been through the lifestyle medicine training or exposed, would you recommend a certain sensitive way to approach that, knowing that's talking about someone's expertise and then you're coming in from the other side there?
I think that's a great question. Dietitians, I'm sure this is the same with nurses. Dietitians love other dietitians. We feel like we understand each other, even if we have different philosophies or different areas of practice. And so I think that's a really great way to broach that conversation is, hey, I'm a member of this organization and they have a great group of dietitians. And they're always looking for new members. Here's their contact information, or here's when their next meeting is, or whatever you want to share with them. But it certainly feels like a little club within the dietetics network. And so we love to connect with other people in our profession. I think that's a great way to broach that conversation.
That's beautiful insight. Thank you.
Mm-hmm.
Susie.
Yes, I know we're here right at the end. Kayli, thank you so much for being with us. Is there anything that you want to share in our last minute that you think is important for us as nurses to know or understand?
Sure. I just want to thank you for all the wonderful work that you do, because being in that supporting role is not easy. And we're the ones that are rolling up our sleeves and really getting in there and doing a lot of the hard work to help people make changes in their lives. And nurses are such a huge part of that. So I'm really happy that we're having this conversation and opening up lines of collaboration, because it's so important.
Yes, I totally agree. I know Deborah does too. Thank you so much for joining us. I know you have to jump off and go do the good work you're doing. So thank you so much.
Thank you.